Right now, if you get a small cut, you clean it, maybe put on a bandage, and forget about it by tomorrow. For 99% of human history, that same cut had roughly a 1 in 3 chance of killing you. Not the wound. What came after it? No antibiotics, no stitches, no painkillers, just infection, fever, and whatever your body could figure out on its own. So what actually happened when your ancestors got sick? The answer is stranger and darker than you'd expect. Let's start with the thing that killed almost everyone. Infection. Your body has no idea what a hospital is. It doesn't know what antibiotics are. It only knows one strategy, fever. Heat up the entire system and hope the invader dies before you do. For hundreds of thousands of years, that was the only defense your ancestors had. A cut on the hand while skinning an animal, a scrape from a fall, a bite from another human during a fight. Any of these could turn into something that killed you in under a week. And it didn't discriminate. The strongest hunter in the camp could die from a splinter. Anthropologists studying skeletal remains from before agriculture found something disturbing. Nearly half of all deaths in early human populations were linked to infection, not violence, not starvation. Infection. Your immune system was doing everything it could, but it was fighting blind, with no idea what it was actually up against. But here's what's fascinating. Your ancestors weren't just waiting to die, they were doing something about it, and some of it actually worked. In 2007, researchers analyzing Neanderthal remains at Shanidar Cave in Iraq found something nobody expected. A skeleton, now called Shanidar 1, showed a body riddled with injuries, a crushed eye socket, a withered arm, a missing lower leg. Any one of these injuries should have been a death sentence in the wild. This individual had survived all of them for years. That doesn't happen by accident. Someone fed this person when they couldn't hunt. Someone changed their dressings. Someone kept them alive through infections that should have killed them in days. This wasn't just survival. This was care. And it gets stranger. In 2012, scientists analyzing dental plaque from another Neanderthal site in Spain found traces of chamomile and yarrow, both bitter plants with no nutritional value, both known anti-inflammatories. Neanderthals weren't eating them for taste. They were self-medicating. 60,000 years before the word medicine existed, something in that brain already understood that pain and inflammation could be fought back. Then there's the skulls. Archaeologists have found human skulls from as far back as 7,000 years ago with holes deliberately cut into them, a procedure called trepanation. Someone took a sharp stone tool and carved a hole directly into a living person's head. You'd expect every one of these patients to die instantly, but the bone tells a different story. On many of these skulls, the edges of the hole are smooth and rounded, which only happens if the bone had time to heal. That means the patient survived the surgery. Some skulls even show multiple healed holes from separate procedures performed years apart on the same person. Whatever this was for, headaches, seizures, evil spirits, whatever they believed was happening inside that skull, it wasn't always a death sentence. Someone had figured out how to cut into a human head and keep that human alive. And it wasn't just skulls they were willing to cut into. In 2006, researchers examining teeth from a Neolithic graveyard in Pakistan, roughly 9,000 years old, found something that shouldn't have existed yet. Tiny, precise holes drilled straight into the enamel of molars, drilled while the person was still alive. Someone had figured out how to bore into a tooth without modern drills, without anesthesia, and without the patient dying of shock or infection afterward. The holes were too clean, too deliberately placed, to be anything but intentional dental work. Whoever performed this had likely done it before, probably many times, refining the technique on person after person until it reliably worked. Somewhere in that community was a specialist, someone whose entire skill was hurting you carefully enough to help you. That role, someone trained specifically to inflict controlled pain in service of healing, is one of the oldest professions we have any evidence of at all. So how did they actually treat sickness day to day? Not with surgery, with plants. Every hunter-gatherer culture ever studied has an encyclopedic knowledge of local plants. Which ones reduce fever? Which ones stop bleeding? Which ones cause vomiting to expel something poisonous? The Hadza of Tanzania still use over 80 different plants for medicinal purposes today. Willow bark, chewed for pain and fever, contains a compound called salicin. Your body converts salicin into salicylic acid. That's the active ingredient in aspirin. Your ancestors were taking aspirin thousands of years before a chemist ever isolated it in a lab. Honey was packed onto open wounds because it's naturally antibacterial, something science wouldn't confirm until the 20th century. But a healer would have known just from watching 100 wounds heal faster with it than without. Maggots were sometimes deliberately introduced into wounds because they eat only dead tissue and leave healthy flesh alone, a technique so effective that some modern hospitals still use it today. None of this came from a textbook. It came from generations of trial, death, and memory. A healer in an ancient camp wasn't guessing. She was carrying the accumulated knowledge of hundreds of years of watching what worked and what didn't, and passing it down before anyone could write it down. But not everything they believed was medicine, and that's where it gets uncomfortable. For most of human history, nobody understood that invisible organisms caused disease. That idea, germ theory, didn't exist until the 1800s. Before that, disease was often explained through spirits, curses, or an imbalance somewhere unseen. If a child in the camp got sick and nothing worked, the community sometimes looked for someone to blame. A person who'd been acting strangely, someone who didn't quite fit. In some cultures, this ended in exile. In others, it ended in far worse. The same instinct that drove people to heal each other could just as easily drive them to turn on each other. Because when you don't understand what's actually happening inside a body, fear fills in the blanks. And quarantine, something that feels distinctly modern, is actually ancient. Long before anyone understood contagion scientifically, communities noticed a pattern. People near a sick person got sick too, so they separated them. Some hunter-gatherer groups would leave a severely ill member behind with food and water when the camp had to move. Not out of cruelty, but because a mobile group survives by moving, and staying near the sick risked everyone. This is one of the darkest parts of ancient medicine. Sometimes the treatment for illness was distance, and sometimes that distance meant being left behind entirely. Then there's the part almost nobody expects. Healing wasn't only physical. In nearly every hunter-gatherer culture ever studied, illness had a ritual component, not because people were naive, but because they'd noticed something real. A person who believed they would recover often did better than a person who'd given up. Shamans, healers, medicine men and women, whatever a culture called them, performed ceremonies alongside the plants and the wound care. Chanting, smoke, rhythmic drumming for hours while the sick person lay at the center of the camp, surrounded by everyone who cared about them. Modern researchers have a name for part of what was happening here. The placebo effect, one of the most well-documented phenomena in medicine. Believing you are being cared for changes your body's actual chemistry, lowers stress hormones, and measurably improves outcomes for certain conditions. Your ancestors didn't know the mechanism. They just knew that a sick person surrounded by ceremony and attention seemed to survive more often than a sick person left alone. So they never left anyone alone. Even when they didn't understand why it worked, they understood that it worked. Childbirth deserves its own mention here, because it might be the most dangerous illness event in ancient life. Giving birth without any modern intervention killed staggering numbers of women, and the surviving evidence suggests communities developed real expertise around it. Older women, often grandmothers, acted as midwives, timing contractions, positioning the mother, using specific plants to slow bleeding after birth. This knowledge was so critical that some anthropologists believe it directly shaped why human grandmothers live so much longer past their reproductive years than any other primate. A grandmother who could save her daughter or granddaughter during birth was worth keeping alive for decades. Here's what should stop you. Your body still runs on this exact same ancient programming. When you get a fever today, your body doesn't know you have Tylenol in the cabinet. It's still running the only program it's ever had. Heat up, sweat it out, hope for the best. When you crave rest and isolation while you're sick, that's not weakness. That's an instinct your ancestors relied on to keep contagion from spreading through camp. When a wound throbs and turns hot to the touch, your immune system is fighting exactly the way it fought 60,000 years ago in a cave in Iraq. We didn't replace this system. We just built better tools on top of it. Antibiotics, vaccines, anesthesia. These are recent additions layered onto a body that still, underneath all of it, thinks it's living in a hunter-gatherer camp with nothing but fire, plants, and each other standing between it and death. For most of human history, survival wasn't about avoiding sickness. Everyone got sick. Survival was about whether the people around you knew what to do when it happened, whether someone fed you when you couldn't hunt, whether someone packed honey onto your wound, whether someone chose to stay instead of leaving you behind. Medicine didn't start in a hospital. It started around a fire, with someone deciding you were worth keeping alive.